Hello, I'm Dr. Ayub. Today I'm here to take a moment to discuss about insight. Insight is degree of awareness about the illness. As we mentioned, this is a degree or level of awareness. So the insight is divided into six levels. The first degree insight in which the patient completely deny the illness, and second degree insight, there's a ambivalence regarding the awareness of illness. The patient says sometime yes or sometime no. And third degree insight, the patient is aware about the illness, but the patient attribute the cause of illness to some external causes. While in fourth degree insight, the attribution is to unknown sources. The fifth degree insight, that is also known as the intellectual insight, in which the patient understands the illness, aware about the causes, but they are not keen to comply with the medical or the advice which are provided to the patient. The sixth level of insight, which is the highest level of insight, is called the emotional insight, in which the patient understand the need for certain changes, and they are also willing to continue the medication. They are willing to continue the follow-up and other pharmacological and non-pharmacological management which are advised for the patient. So on the basis of degree or awareness, the attribution, and the subsequent change in the behavior, the insight is divided into six levels. How to assess the insight? As we know, this is something we call a subjective experience. So we need a certain technique to assess for the insight. So there are certain questions we can ask to the patient. The first question we can ask to the patient: do you consider yourself ill in any way? If patient say yes, then we ask the next question, that is it related to physical or psychiatric issue? Thereafter, the next question is about the attribution. We can ask the patient, what is your explanation for these symptoms? Patient can answer this could be due to some black magic, or they can answer like this could be due to some psychiatric illness, or this could be due to some biochemical changes or any change in the brain, or they can attribute to its I don't know or unknown sources. If they, after checking for the attribution, then we ask the patient, do you feel you need any sort of help? If patient say yes, then we can ask, which sort of help do you think might be helpful for you? Thereafter, we need to ask about, will you agree to continue the medication, and will you agree to continue the regular follow-ups? These are some of the questions which are important to assess for the insight. This is insight wisdom to remember the different levels of insight, as sometimes we forget it. So the first level of insight we know is the denial of the illness. So as we know, in every reaction, the first response is denial. So we can remember the first level insight is denial, and the ambivalence. So it's two contradicting thought. It is second level of insight. The third level or fourth level of insight are related to attribution. Attribution could be to known or to unknown, and the intelligence is understanding the illness, while the emotional insight is comprehending the need for change. So I hope this was useful for you, and if there's any question related to this, kindly feel free to write in the chat box. Thank you for listening.